Hi, I'm Dr. Kasia Kines. I am CEO and founder of EBV Global Institute. And today we're going to talk about EBV and depression. I want to make a reservation. I was thinking about it preparing for this talk. And what I have to say is in the world of EBV information, there's different layers that you have to be careful about. There's a spiritual sourcing of information, like the spirit of compassion in the medical medium. Then there's medical literature. Some things in medical literature are already proven, some look promising. And then there's area, the third layer of information is anecdotal stories, which means we don't have studies yet. And depression is one of those topics. We don't have a lot of studies on EBV. There are certain patterns that I see over the years in our community. They are pretty consistent. And so when I decided which things to pull out for the topic of depression in EBV, I pulled out 9 most common presentations. Some are related directly to EBV, some are not. So some are indirect. So I'm going to discuss all of these. These are based on my clinical experience, on commonality, on patterns that I see. Hold on, my kitty wants to speak. Charlie. No, no. This is what happens when you have a home office. Let me give him a treat. So let's start with the studies first. There are just a handful of studies, not many. We don't really know the exact mechanism why EBV directly causes depression. I can guess. I'm not going to go into it, but let's talk. Let's talk about the few studies that we have. There's one from 1984, talking about chronic mononucleosis syndrome, acknowledging that EBV can go chronic, like chronic fatigue. And on the list of common symptoms like headaches, myalgia, which is muscle pain, persistent fatigue, lymph nodes involvement, prolonged recovery. There's also place for, they're talking about uh, depression as well. Low-grade fever, aching legs, weakness, all that. And this is a study by Eligio, EBV chronic infections, 1984. There's another old study from 1986 that actually acknowledged that while the EBV is generally described as malaise with fatigue, pharyngitis, and large lymph nodes, again, they say, however, depression also commonly accompanies these symptoms. In some cases, the depression and constitutional symptoms may last for several months and even years after acute physical symptoms subside. This is very important because I would say, along with brain fog, very heavy fatigue, and often anxiety, depression is one of the most common symptoms that come with chronic EBV. And oftentimes in our community, people are directed to psychiatrists and are pushed towards antidepressant medications. And oftentimes in our community, you will hear comments like, I'm not a depressive person. I don't have a depression because I have a depression. There's something else going on. Hi, Dami. Welcome to the live Facebook call. So it's very common to actually end up on antidepressants, and sometimes antidepressants are valid because you have issues, and sometimes circumstances really require that you take that step to kind of protect yourself and you are safe for a period of time. That's not the situation we're discussing today, though. There's another study that there's 2 studies that are newer. There's one study from 2017 talking about depressive symptoms associated with salivary shedding of EBV virus in female adolescents. So they were actually taking sample of saliva and measuring DNA of the virus and VCA IgG. Males didn't have that pattern, only females, and it's probably related to female hormones and the way women deal with stress. So anyway, this is another acknowledgement that as they were finding more salivary involvement with the virus, there were more depressive symptoms. And then there's a study from 2021. This is a big study because this is almost 1.5 million Danish children and adolescents. So this is they looked at all this population and pulled out over 12,500 cases of those young people having mono and being hospitalized for mono. So that was pretty severe mono. And they then correlated to the cases of major depression requiring hospitalization. So we're talking about serious depression here, hospitalization for mono, hospitalization for depression. And what they found was that mono was associated with 40% increase in risk of depression. And similarly to the other old studies, we're talking about a longer period of time. They say especially 1 to 4 years after mono diagnosis. So don't be surprised if you've had a mono or if you've had EBV for a while and that depression starts anchoring in over a period of time, not maybe immediately. So this is all that we have from studies. So today I'm not going to talk about how virus gets into the brain and causes depression directly because we don't really understand that quite yet. I have my suspicions, but that would be a completely different topic. But let's talk about. So number one is direct effect. It is. I'm validating it for you. It's not just in your head. It's real. But let's talk about the 8 other reasons why you may have depression. Number 2 is low thyroid function. When you have low thyroid function, that can lead to depression by itself. I will make a reservation that majority of low thyroid, or what you call hypothyroidism, is actually autoimmune. Hashimoto's thyroiditis, and in many cases that condition is caused directly by EBV or other co-infections like H. pylori. We often see that. So whether it's just low thyroid or Hashimoto's, which will eventually cause low thyroid, you can develop depression right there. Number 3, circumstantial depression. The damage that the virus causes to your life, to your quality of life, ability to bring income or be the mom or function as a professional, it's very depressing. It's demoralizing. So oftentimes our community says, I'm not a depressed person. I'm not a depressive personality, but I am depressed because this is really very difficult. Number 4 is EMF exposure, electromagnetic field. That typically causes depression, anxiety, and a host of other symptoms. And what I'm finding really distressing and alarming is the intensity of exposure that has been increasing over a few recent years, and how commonly our community relies on Wi-Fi technology, even using your phone as an alarm clock, which is a no-no. So that's number 4. Number 5, insomnia. If you disrupt sleep, you disrupt the production of serotonin, and lack of serotonin is more depression. So we have an entire chapter in my book on sleep patterns. We have an entire module in the EBV recovery program that I teach, because sleep disturbance is very common. There is a particular pattern in our community, so this needs to be addressed. If you don't sleep, you're going to be constantly in inflammatory state. You won't be able to heal. It's an uphill battle. Number 6, MTHFR gene SNP, the infamous folate impairment. It's very common in our community to have that gene SNP, so you have an impairment in metabolizing folate from diet. So you have to be on methylated B complex. I would recommend B complex methylated for anyone with EBV because of chronic stress. And these are stress vitamins that are depleted. Whether you have this gene SNP or not, methylated folate will be in it. It's very common gene SNP. It doesn't cause a lot of problems in most people, but it does impair some functions, detoxification, and you're more prone to reactivating EBV. Number 7 is deficiencies. Nutritional deficiencies are basically responsible for up to 80% of chronic illness in human beings. Um, and it's not different with EBV, unfortunately. I can tell you that it's verified in medical studies. I see it all the time. As your nutritional status drops, the virus becomes more virulent, as studies say, which means more aggressive. And we have rampant deficiencies. Your status for nutrients drops when you are under stress, which EBV causes, so you don't eat that well. So it's like perpetuating the cycle. Particular nutrients that cause, which when deficient can cause depression are B1 thiamine, B2 riboflavin, B3 niacin, B5 pantothenic acid, B6 and folic acid, B12, and surprise, surprise, vitamin C. Vitamin C, yes, can cause depression if it's low. Number 8, hypochlorhydria. Losing the ability to properly digest proteins because the stomach acid secretions are dropping down. That happens with age oftentimes, but also people that have a lot of complicated chronic conditions, and that includes chronic EBV. We often find that that stomach acid is not produced enough, and that is very detrimental. Uh, the stomach acid is responsible for those B vitamins and many key nutrients. So if you're not secreting enough stomach acid, those B vitamins are not going to be properly assimilated. And like I talked about, certain B vitamins are necessary to prevent depression. And so that's a big deal that has to be assessed. It's quite common and can, of course, lead to depression because you're missing the B vitamins. B vitamins are also depleted in stress. These are called stress vitamins, which brings me to number 9. Our last but not least issue is stress. Stress will cause depression on many levels. First of all, women deplete serotonin much faster than men in stress. So repletion is really important. Um, uh, Eating better during stress is very important because we just talked about depletion of nutrients leading to more reactivation of the virus. And let me see what else. In stress, we urinate our major nutrients, including B vitamins. We use them in stress fast, but we also urinate them. We urinate out magnesium in stress. So can you see how chronic stress can deplete your nutrients, some of which are necessary to prevent depression? There we go. So 14 minutes. I went pretty fast. These are the 9 major things that I see clinically that are relevant to majority in our community. Hopefully this helps you. If you have a clinician that is very experienced, they can tackle these issues. We do provide support in our EBV recovery program for all of these issues because that's just what I do. And also, if you are joining us here live or close to live with a recording, we have an EBV transformational workshop coming up soon. Hopefully you will join us. We will have information about it here in this Facebook, and if you're watching it on YouTube, all you need to do is go to ebvhelp.com, HELP.com, with all the resources, updates, posts of events we have coming up. With that, hopefully it's helpful. Let me know what you think in the in the thread below the video. I can't wait to hear how relevant this is and if it helps you moving forward.